Hi everyone, I'm Dr. Pankaj Singh, Senior Consultant Gastroenterology at Gastropedia Clinic, Noida. Today I'll be discussing about inflammatory bowel disease. What is inflammatory bowel disease? Inflammatory bowel disease means there is a long-standing inflammation of the digestive system or the digestive tract, and primarily the problem is with the immune system. And if you see what are the broad categories or classification of inflammatory bowel disease, there are two categories. One is ulcerative colitis, and another is a Crohn's disease. So the basic difference between ulcerative colitis and the Crohn's disease is that ulcerative colitis primarily involves the larger intestine, and the Crohn's disease can involve both the large intestine and the small intestine, but the area of involvement is mostly ileocecal region, or the area where the small intestine ends and the large intestine begins. And apart from these, the pathophysiologically, the ulcerative colitis has a mucosal involvement. That means it involves the inner layer of the intestine, whereas the Crohn's disease can involve the deeper layer. It can have a transmural involvement, like it can involve pathophysiologically, it can involve all the layers of the intestine. Now coming to the symptom, on the basis of symptom, it is very difficult to differentiate between the two. But the most common symptoms that we come across in ulcerative colitis is bloody diarrhea. Apart from these, severe cases can have associated fever, pain, abdomen, tachycardia. In those with Crohn's disease, can have obstructive symptoms like pain, vomiting, and the amount of blood in the stool is relatively less in Crohn's disease. Now, what are the risk factors for Crohn's disease? The risk factors can be family history. Sometimes person may have family history of the similar problem. It can be genetic link up can be there. And one important interesting fact about the cigarette smoking is that cigarette smoking is said to be protective in patients with ulcerative colitis. At the same time, it can be a provocating factor in patients with Crohn's disease. And the use of painkillers like NSAIDs, Brufen, naproxen can also trigger inflammatory bowel disease. And secondary infections in the intestine like gut infections causing diarrhea can also trigger the symptoms of inflammatory bowel disease. Now coming to the complications of inflammatory bowel disease, the complications which can be common to both UC, ulcerative colitis, and Crohn's disease are like colon cancer can be a dreaded complication. Extraintestinal manifestation, sometimes these patients can have redness in the eye, they can have joint pain. These are the common extraintestinal manifestations of inflammatory bowel disease. Then there can be a lot of side effects of the medicines which are used in the treatment of these two conditions. PSC is primary sclerosing cholangitis, is a pathology of the biliary system which can be there in both UC and Crohn's. Apart from this, there can be clot formation in the vessels, and there are certain specific complications of Crohn's disease like obstruction in the intestine, fistula formation in the intestine. They can be specific to Crohn's disease. The ulcerative colitis, there can be megacolon, that means dilatation of the intestine leading to sometimes perforation and peritonitis. Now coming to the diagnosis of this condition, basically first and foremost thing is the history. The patient usually presents with a complaint of bloody diarrhea. When we have this kind of symptoms, we do certain tests like sigmoidoscopy and colonoscopy to see or look into the cause for the blood in stool. And in those with ulcerative colitis, we see that there is a continuous involvement without any skip lesion or skip areas in the intestine, the large intestine primarily. And Crohn's disease, they can have large intestine involvement, but the area involvement will be patchy. That means the lesions are here and there with some normal islands of mucosa in between. And Crohn's disease, they do have more involvement of the ileocecal region. That means the terminal part of the small intestine, the large intestine, where it begins. And diagnosis is primarily on the basis of the biopsy. We take tissue specimen, and then on the basis of that we diagnose. We also do certain stool tests to rule out other secondary infections which can trigger the cause, like Clostridium difficile infection, amoebiasis can trigger. So these are the way we proceed in the diagnosis. Once the diagnosis is confirmed, the treatment part, we either use anti-inflammatory, antibiotics. And in both ulcerative colitis and Crohn's, we use anti-inflammatory drug like mesalamine, which acts in healing the mucosal ulcers. And then second line of treatment would be immunosuppressant drug like azathioprine and mercaptopurine. These are the drugs which can be used for immunosuppression, like most commonly steroids. Steroids are the salvage drug in ulcerative colitis and also in Crohn's disease. And if the patients are not responding to this kind of management, we switch over to third class of therapy, which is known as biologics. Biologics are immune modulators, which are commonly come by the name of infliximab, adalimumab, and these are the tofacitinib. These are the drugs which are used in the treatment of IBD. And few cases who do not respond to this kind of Therapy with immunosuppressant and biologics may need surgical interventions in both ulcerative colitis and Crohn's disease. So this is how we diagnose and treat inflammatory bowel disease. Thank you.